my name is Adam Stout. I'm here with the chairman of the Asia Cloud Computing Association, Bernie Trudell, and we're here to talk about the most recent developments in the healthcare industry and cloud computing in Asia. So, welcome, Bernie.
Thanks, Adam. Glad to be here.
So, what are the top reasons why the healthcare industry in Asia are taking advantage of cloud computing?
Well, really, there's three drivers that's forcing the healthcare industry to go towards cloud computing. One is the cost savings to the IT organization. A second one is the agility that's brought to processes for the operation of the healthcare organization. And the third one is new revenue streams for engaging patients and customers.
So, how is cloud computing changing the way that the medical practice and the healthcare systems are utilizing and storing data?
Well, electronic medical records have been around for some time, and that's of course resulted in a space saving, in a time savings, and less errors. Now, cloud computing is bringing that to the next generation using electronic health records. Electronic health records is where you have all of the patient's records into one record and typically kept on the cloud. The next evolution of that will be the patient health record, where now the health record is on the cloud, but the patient has control of it, and the patient can provide authorization to different parts of the medical industry to have access to that. The other piece we're seeing along with data and cloud is medical practitioners are starting to really think about data classification and what kind of security, durability, confidentiality is associated with those different classes of data.
So it's great that we are storing and utilizing all this data up in the cloud, but what is there to ensure that it's secure for both the healthcare industry and for the patient?
Well, with public cloud providers have really understood the fact that security is going to be top of mind for many people because it's a shared infrastructure. And so with that in mind, what they've done is they've built in quite a bit of security, whether it's the encryption that comes in by default for data at rest or data in transit. On the authentication side, from a cloud access, they're forcing users to use multi-factor authentication, making it easy for them to use it, but at the same time giving them that added security. And then finally, built into the cloud itself, there's multi-layers of separation in order to keep everyone's data, everyone's applications secure and separate from each other. That's one side of the security angle. The other side of the security angle is cloud users are realizing that it isn't only the cloud provider that has to provide the security, but there is their responsibility, whether it's the device that they're using to access the cloud or the access method that they're using, that those are secure, and that's the responsibility of the cloud user. So that awareness of their security responsibility has really increased over the last few years.
So it sounds like there's a lot of movement towards security and making sure that our data is actually more secure in the cloud than it is even on your own personal computer.
Yeah, I'd say cloud services are probably more secure than most on-premise IT systems.
So that being said, what are the other trends that are going on in cloud computing and the medical industry that you see moving forward, taking advantage of this technology?
Well, there's really two large ones. One is around what's commonly called health tech. And health tech is associated with sensors and wearables. That's one new trend. Another one is medical practitioners and especially ministries of health are finally getting access to long sought after anonymized data to make better policies, and medical practitioners come out with better cures. So if we look at on the wearable side, obviously personal sensors give individuals control of their own health. and more focused on healthy living and healthy lifestyle versus curing. But of course, there are those that do have diseases where, for example, an insulin pump might be used, and tying that insulin pump to a blood sugar monitor is an area that's being explored in the health tech space. So these are really the two main trends that we're seeing, new trends that we're seeing with cloud computing and healthcare.
So the development of taking care of your own healthcare through sensors and wearables to ensure that you don't get sick instead of treating the disease that.
Exactly, right.
This all sounds wonderful that we're moving forward with digitization of the healthcare system, but as we both know, one of the big issues in Asia is healthcare for the rural working class. What is cloud computing and the healthcare industry doing to help address some of the gaps that we see between healthcare in the rural part of the countries?
Yeah, so certainly before cloud computing, of course, telemedicine has been around for some time, and obviously leveraging things like the phone, maybe even remote video cameras, and even SMS reminders for patients to continue their medical treatment. But what we're seeing now is, because there is a lack of density, either in poor countries or in rural poor also, and so what we're seeing is, again, ministries of health putting in programs that allow access to specialists that might be in an urban area but can be accessed by these rural communities. In addition to that, with the proliferation of smartphones that we have around, there are apps now being sponsored by both service providers and governments to provide 24/365 health advice. And if we go back to the patient health record, now the patient can actually provide access to these specialists that are online and can provide them advice in many cases. So things are getting much better from a telemedicine and access to specialists for both of these rural and poor communities.
It really seems like the cloud computing industry and advancements in the ICT areas are really going to revolutionize the way we take care of ourselves and the way we treat patients. So I, for one, am excited to see what comes up after this. But do you have any final words on?
You know, if we look beyond what we're seeing today to something that's often referred to as artificial intelligence, but the machine learning algorithms that are now being applied in the healthcare industry to revolutionize some of the routine tasks that are present, will really change the way the healthcare industry and cures are delivered towards patients. So yeah, definitely a big change both now and in the future with cloud computing in the healthcare industry.
Well, thank you, Bernie, and I look forward to our next conversation and our next topic.
Thanks, Adam. It was a pleasure.
Once again, visit the www.asiacloudcomputing.org for more information on our most recent healthcare report.